The Unbroken Place podcast with Eddy Paul Thomas is a production of Say Something Studios.
You know what is amazing to me is that the concept of health insurance, private health insurance in the United States, grew out of mutual aid. This is wild. This history is wild to me because it came from the concept of Black communities and immigrant communities who didn't have access to the same money and the same resources as some of the more privileged neighbors, built up reserves to help each other when they needed something. And that's how health insurance started. That's how people started building up health insurance, so when someone got cancer, the community came together to pay for their treatment.
Welcome back to The Unbroken Place, where it begins and ends with empathy. I'm your host, Eddy Paul Thomas, and today we have a really good conversation for you about the status of healthcare in the United States with Laura Starr. Laura spent the last 26 years helping nonprofit organizations build the structures needed to support their critical work in the community. For more than a decade, that's looked like making sure people get the health care they need regardless of their ability to pay. As the executive director of the Illinois Association of Free and Charitable Clinics, Laura leads a statewide network of more than 40 clinics serving uninsured and underinsured people. So let's get into it. Laura, thank you so much for joining us on The Unbroken Place. We are really focusing a lot this coming year, this coming season on empathy when it comes to mental health. And with your extensive experience in the field, I thought you'd be perfect to have on the show. So thank you so much for joining us.
Thanks for having me, Eddy. I'm happy to be here.
Yeah, outstanding. So I'll just start here, Laura. For those who may not be familiar, can you kind of paint the picture of what the free and charitable clinic landscape actually looks like across Illinois?
Yes. So, free and charitable clinics are exactly what the name sounds like. These are healthcare providers. Each one is really unique to the community that they're serving, but they are there for the people who are uninsured or underinsured, people who can't afford to get access to healthcare. And the free and charitable clinics are there. They provide those services to people in the community at no charge whatsoever or at deeply, deeply discounted rates if they're able to pay a little bit of something. But a free or a charitable clinic is never going to turn away an uninsured person who has no way to pay for their health care. We're really there to make sure that everybody has access to the care that they need. And that can look a lot of different ways. It's completely they're dependent on the community needs. Every clinic, as I said before, is built on what that community needs. So that can look really broad. So in Chicago, we have the largest free health clinic in the country in community health, and they try to be as full service a medical home as possible. So they're the primary care doctor, their dentist, their pharmacist, their anybody and everybody all under one roof. But it could also be really specific. So we have one clinic who just joined our association who is just a mobile vision clinic providing screenings for recently incarcerated individuals who need that vision care in order to be able to get jobs and lead productive lives in the community. So
Right, right.
very broad and very specific, and the clinics are there to meet those needs.
That's outstanding. And I think, in our previous conversations, you talked about how unique some of those opportunities are, things that we wouldn't really think about. Like what would you say is one of those examples that the average person wouldn't really think, oh, gee, yeah, healthcare in that situation really makes sense.
Yeah, one of my favorite examples is we have a clinic, the Racing Industry Charitable Foundation, who exist only on horse race tracks in the state of Illinois. There are individuals who live and work on the horse race tracks, which I didn't know until I got to know this clinic, but whose jobs are to care for the horses. And those families, in many cases, are very low income, don't have access to health insurance. And the Racing Industry Charitable Foundation is their healthcare provider, their behavioral healthcare provider, their anything and everything they need healthcare related. And so that's one of those really, really unique examples that I'd love to share with people, because that's something that I had honestly not thought of until I heard about this clinic.
Yeah. Yeah. I think what as I think about the story that you're telling me about the unique opportunities for that particular group, um, it also kind of you do the zoom out and you think about what's going on currently for people in healthcare. And I know that in my state here in North Carolina, we just dealt with news that we are losing Medicare and Medicaid. Not entirely, but we're
Right.
having a great reduction here. And I'm curious, if that's reached Illinois number one and number two. If so, are you seeing like an uptick? What does that look like for you guys?
Yeah. So I'm fortunate first of all to be in Illinois, where our state government has a definite commitment to making sure that people get access to health care. But that is does not help when we're facing a situation at the federal level where cuts are coming down fast and furious. And with the current budget bill, that HR1 that passed last year, there are incremental cuts that have been happening. Last fall, dreamers, DACA recipients, people who were brought to this country as children, um, have a number of um, have a number of benefits that they can apply for and become entitled to through the government. They can get work eligibility. They can get health care. They can get a lot of different things under this Deferred Action for Childhood Arrivals program. Last fall, they lost the ability to buy themselves health insurance on the marketplace last August across the country. Um, January 1st of this year, everybody, US born citizens and immigrants alike, lost tax credits for those that were buying insurance on the marketplace. And here in Illinois, that meant, I just read earlier this week, average costs went up about 26% for people paying for their own health insurance out of pocket because they don't get it in their employer from their employer. So those have already happened, and
Yeah.
Medicaid and Medicare cuts are coming down the pike in the next month, months and years between now and next January. Additional cuts are happening. So we're anticipating that about 500,000 people in Illinois are going to be losing their health insurance over the next 2 years. Yeah. And free and charitable clinics are uniquely positioned to support those individuals.
Hmm.
But of course, everyone's capacity is limited. Nobody can, without additional investment, take care of everyone. We will try because that is what we do and that is what we have
Yeah.
always done. But
Yeah.
500,000 people is is
It's
five
bonkers.
times what we're seeing right now.
Yeah. Yeah. The totality of it. See, for those who don't know on the show, I've spoken before about working with different underserved populations. The majority of that was in mental health care, mental
Mhm.
health outreach teams, grant funded programs that really sought to create ways and access for people who could not otherwise receive care. But when I look at what's going on right now, like if you take the stress of an ICE out of the picture and just look at the budget cuts, what are happening right now, and look at what has been done in education as well, where they're not funding some medical positions anymore in terms of for their degrees. I'm trying to look at the realistic level of stress that your clinics may be facing here in the next 4 to 5 years. I mean, just looking at the next graduating class, and you know, so what kind of plans, if any, do you guys have in Illinois now? Just kind of looking at this new playing field that's literally just been laid out for us. What does that look like for you guys?
Well, what I'm really trying to focus on in my role is the mission of the association that I lead is to strengthen and resource these clinics. And so what I want to do is to help build their capacity to raise more money, to recruit more both employee and volunteer providers. That's a big piece of what makes up the strength of the free and charitable clinic is that we have many, many, many volunteer providers who who donate their time to the to see patients at free and charitable clinics. And so what I'm working on is building programs to help them work with each other, work collectively to recruit those providers. Dental providers is a huge need, for example, that I've heard from clinic after clinic after clinic. We need more dentists. And so I want to help them figure out how to get out there, how to build those relationships that will help them find the people who want to give their time to provide dental services, to provide behavioral health services, um, to learn how to write a grant, to talk to each other about what are your medical best practices in the clinic. What are the performance indicators that you're trying to meet to make sure that you are influencing people's healths? What I'm trying to do is really convene the clinics to make us all stronger collectively and to secure investment both from the state of Illinois and from private foundations to help them do that, help them become stronger, because you're absolutely right. We are already facing capacity challenges. We're already
Yeah.
facing provider recruitment challenges. Another thing that you didn't mention that is likely to be happening is that a lot of people who either get employed by or spend most of their time in these free and charitable clinics are counting on some loan forgiveness from their student loans that they took out to go in and get their medical degrees.
Right.
And that that status as an agency that qualifies for loan forgiveness could very well be taken away. At times, even nonprofit status has been threatened by the current administration for free and charitable clinics because so many of the people that we care for, so many of the people who don't have health insurance are immigrants to this
Yeah.
country.
Yeah. Well, with some of the things that are going in terms of American citizens who are losing their job by the
Yep.
thousands to the
Yep.
influx of AI, or let me say that a better way. They're not losing their jobs to AI. They're losing their jobs to short-sighted leadership within organizations who believe that
Yep.
jobs can just simply be replaced
Yeah.
by AI. I know that I've read an article last week where one company was like, yeah, we made a mistake. And they're literally trying to rehire people that they let go by the thousands. So there are a lot of challenges that are coming kind of all at once, right now.
Hmm.
And I see this
Yeah.
big strain in the healthcare arena. I'm
You're
I'm
absolutely right.
curious. Oh, go
Well, I
ahead.
was
Go
just
ahead.
going to say, yeah, if you eliminate your entry level workers and replace them with AI, you have no leadership pipeline.
That kind of makes me recall um, my time working again with those vulnerable populations. When we talk about accessibility and some of the barriers that were already in place, one of the hardest things to win was trust
Yeah.
of those individuals, not just to get them there, but to get them to come back.
Hmm.
And now with these things that I see as even more steep and intentional roadblocks. How do you guys think you can maneuver and place yourself to win trust of those who are seeing a system kind of crumble all around?
Yeah. Well, the incredible thing is that the clinics already have their patients' trust. And
Mm,
uh, from a very personal example, before joining the Illinois Association of Free and Charitable Clinics, I spent 12 years at Community Health, which is primarily an immigrant serving clinic in the city of Chicago. And last year during really heightened moments of immigration enforcement activity, we saw at times a 40% drop in people showing up for their health care appointments. It was a ghost town in that waiting room. But what the clinic did was start texting people and saying, you have an appointment coming up. Would you like to switch it to telehealth? Would you like to cancel? Would you like to reschedule? What do you want to do? Also, you have a medication in the pharmacy that you need to pick up. Let's just remind you that you can send somebody else to pick up your medication for you if you need to. Do you need a ride? We can provide you an Uber Health ride to get to the clinic. And when community health started doing each of these things, and all of the clinics have been doing things like this, the people came back like that. The the attendance at those appointments rebounded almost immediately because people wanted to come to the clinics that they trust. And that's something that I find so remarkable is that this trust even withstands the fear of leaving your own house that many of these families were going through. They didn't want to go to the grocery store. They didn't want to go to school or to work, but they wanted to come to their healthcare appointment. And the impact that that makes on their ability to do all of those things when they're ready to go to school and to work and to the grocery store, it makes a tremendous difference.
yeah, yeah. I see something like that just improving numbers in terms of health outcomes,
Yeah.
um, in so many different ways, and hearing you say that, and thinking about your career, you've been in the trenches during COVID,
Mhm.
and I know that for me, working in the various aspects of business and ministry and nonprofit that I was at that time, there were so many innovations that came out
Yeah.
of that time. The way in which people, like, there's a medical missions group that figured out a way. Well, you know what? Let's get this community a handful of iPads that are kind of to the wall, and let them do their telehealth right there. And there were so many really cool opportunities that came from people having to or being forced to think outside the box during COVID. I'm curious if that if the hardships that we're looking at right now, just in the next 4 to 5 years, again, looking at the cuts, looking at how education is being treated, all of those different things. If there are innovations that you see coming down the pike for healthcare, whether it be physical or mental health.
Yeah. I think co-location of services has been really dramatically impactful. And so this was some
Unpack what that is for those who may
Yeah,
not
let
be
me
initiated.
yeah. So for an example, community health that I was just talking about has begun to build what they call microsite clinics. And these are located inside a social service agency. These are inside a building where people are going for a food pantry or legal aid or ESL classes or something else that they already go to. They already know this in their neighborhood. They already know this organization and trust this organization. And community
Hmm.
health is standing up mini clinics inside that same organization to say, we are here as a trusted partner and you can come to us for healthcare too. And so that's been really, really impactful. And I've started to see other clinics do it too. There's one called the Hope Center all the way up in Lake Zurich, Illinois, which interestingly, like a lot of people think of the Lake Zurich area as this very wealthy community, but it's surrounded by rural areas where there's a lot of
Yeah.
poverty. And
Yeah.
those individuals didn't have places that they could go. And it started with a food pantry there too. It started with the Hope Center, this church in Lake Zurich, Illinois, funded by all of their wealthy parishioners, started a food pantry. And then they said, oh, you know what? We're not getting very fresh produce for our food pantry. Let's start a farm on our property. And they started growing their own fruits and vegetables. And then the community said, hey, can you grow these herbs that are very specific to our community? And they were like, yeah, teach us how. And then they went, oh, let's do a clothing closet where people can get the clothes that they need for their family 4 times a year. And then they started to opened up a medical clinic. It's the same thing, and it's all under one roof. It happens every Saturday. I went to visit, and it was incredible. Like, it just gave me goosebumps. The place was crawling with people
Yeah.
getting every single service that they could think of under the sun, just donated by their community members who saw a need and were like, how can we make a difference? How can we support it? And so they're co-locating those services. They're bringing all of the things together so that people can get all of their needs met, and then they can go on with the rest of their lives. They can live their lives without having to worry about, oh, should I get more food or my medications this week?
Right.
Do I have to choose between buying my kid a new pair of shoes and getting my asthma inhaler? People don't have to choose because the organizations are working together to get all of these needs met all under one roof. It's really
Yeah.
powerful.
Yeah.
And
That's
it's low
wonderful.
tech. That's the
Yeah.
amazing thing
Yeah.
too. It's crazy that
Exactly.
it's so innovative.
It's innovative, and there's already space. You know what I mean? It's not like
Yeah.
you're needing to get all this capital together to do this, that, and the other. I live in rural Charlotte.
Yeah.
We're like literally a mile from South Carolina out here. And one of the things that I've started to see is more and more clinics that are popping up right next to grocery stores.
Yeah.
Where people already get their food and go get their gasoline. The clinic will be right there, and it's more accessible now, um, in at least in the Charlotte area. But I'm just in general, one of the things that does give me hope, um, as we kind of look at where we are and what's going forward, is the idea that there's always been this tension between individuality in our country and communal
Yeah.
thought. And the tension seems to be leaning more heavily towards communal.
Hmm.
And if you think about the way that we are wired as human beings, we are communal.
Yeah.
There's no situation in which you take communal mindsets and put them into the workplace, put them into education, put them into healthcare, where we don't benefit greatly from it.
Yeah.
And so I love just kind of listening to the stories of things that are kind of bubbling up out of not just necessity, but innovation, where it's like, hey, this is innovation, but we're literally just going back to what we were wired to do from the beginning. And
Yeah.
that's wonderful.
It's it's people's instinct. And this has nothing to do
Yeah.
with health clinics, but I think of an example from my own son when he was, I think, in third grade.
Hmm.
He is in our local public school in a dual language program, half the day in English, half the day in Spanish. And a family moved to the neighborhood from Japan, and this child joined his third grade class. He spoke 5 languages, but English was his weakest. Um, because the family had moved all over. And for a long time at school, he carried around an iPad to help him with translations and things as he was learning. But I asked my son one day, I said, how do you play with this little boy on the playground? And he said, oh yeah, he plays football with us and all of this. And I said, how do you communicate with each other? And he said, well, his English isn't that good yet, so but we're all learning Spanish, so we just speak Spanish with him on the playground.
Hmm.
And we don't speak Spanish at home in my house. Like I can't I studied French, as you know. And
Yeah.
so but my kid, that was his instinct, was to go, this is how we can communicate with each other. That's what I think all people are wired to do. We're wired to figure out how we can get by and help each other get by. You, I start crying at parades and things like that because I'm just so moved by this communal effort. And when I see this
Yeah.
high school marching band all making an effort together, it gets me
Yeah.
because that's
Yeah.
how we're supposed to be.
Don't go anywhere. The Unbroken Place will be back in just a moment. What if the clarity you've been searching for isn't out there, but already within you? I'm Eddy Paul Thomas, life and leadership coach. I work with purpose-driven people who are ready to lead boldly, live intentionally, and grow from the inside out. Whether you're at a crossroads or leveling up, coaching can help you move with focus, confidence, and wisdom. This is your time. Visit onsecondthoughtstudio.com to get started.
Looking for a way to reconnect and reset? Awaken Pittsburgh offers free guided meditations open to everyone, online and in person, on the first and third Wednesday, second Saturday, and third Monday of each month. Each session includes guided practice, reflection, and space for questions and support. No experience needed. Sign up on Eventbrite and join the community.
In a world where thriving teams, engaged managers, and ethical leaders are the backbone of successful business, how do entrepreneurs set the stage for human flourishing while scaling up? The answer is ongoing effort, leadership, and intentional communication. At Elevate One Consulting, Dr. Erica Garcia Thomas and Eddy Paul Thomas are helping to turn the tide. With a blend of evidence-based practices, interactive teaching, and dynamic public speaking, they're not just consultants, but revolutionaries in improving company health, growth results, and employee engagement. Specializing in revitalizing brands, coaching leaders, and accelerating projects, Elevate One Consulting offers a comprehensive suite of business services designed to enhance team leadership and customer experience. Whether advising executives, guiding digital marketing strategies, or transforming organizational culture, they're here to elevate your business to the next level. Don't settle for a business that survives. Ensure that it thrives. Visit www.elevateoneconsulting.com. ELEVATE 1consulting.com today and take the first step towards creating an environment where everyone flourishes. Elevate One Consulting. Innovate, grow, elevate.
Imagine a place where the untold stories of Black missionaries are amplified, honored, and celebrated. A place that bridges the legacy of the people of the way with the powerful missions work of today's African diaspora. Welcome to the Black Missions Museum, a digital project dedicated to preserving the voices, culture, and legacy of Black missionaries across the globe. But we need your help to bring this vision to life. Your support makes a difference. Join us in this mission by donating today. Just click the link in the show notes to give and be a part of history. Together, we can inspire future generations and keep the legacy alive. And we're back. Yeah, it's the potential is always there, I think that what we're living through right now is kind of forcing some people to see that, to understand that we need each other.
Yeah.
And these things that these identity markers that we held so tightly, we start to realize that they really didn't have that much strength when push came to shove. And so it's hopeful. It's hopeful, and it's certainly forcing people to see the world a little differently now. Um, I'm curious about one thing. I know that at least from your bio and from when we spoke earlier, you made a shift. You went from direct care to leading the association. Um, how did that shift kind of change your understanding of impact and where change can happen more, not necessarily really happen, but like where it can happen more deeply?
Yes, I spent the last 12 years in an organization that was directly providing the healthcare services. And I loved it. I loved being part of that organization. I was so proud of
Yeah.
the work that we were doing. And particularly after 5 years of unprecedented time after unprecedented time, we had COVID, we had a migrant crisis in Chicago where people were being bussed up from border states and sleeping in police stations for
Unreal.
months on end. Then we had immigration enforcement activity in 2025 that was scaring a lot of people into their homes. We've just had crisis after crisis after crisis in the healthcare space. And I was so burned out. I was
Yeah.
so burned out. All
Yeah.
of my colleagues and I were so committed to being there for our patients, and we were struggling. And I didn't want to leave the army. I didn't want to leave the choir that was singing the song of everybody deserves access to healthcare. I want to continue to be part of that work. But on
Yeah.
a day to day basis, when I was literally manning the front door at times to make sure only people with an appointment were coming in, it was tough. I wasn't sleeping well. Um, and I had worked with, as a clinic, we were a member of this association. I had worked with this association for that dozen years. And when the opportunity came to move to the association level, I jumped. I was so excited at the opportunity because what I really love to do, I'm not a healthcare provider myself. I am the scaffolding. I'm the person that bolsters up the sides of the organization, make sure we have raised enough money, make sure we get the word out so we can recruit volunteers and we can recruit new patients and do all of that fundraising, the communications, and the actual operational building work behind the scenes. And I can do that at the association level for an entire network across the state. So for me, it feels like a very, very logical transition. And I'm sleeping much better because I'm
Yeah.
building that
Yeah.
scaffolding for lots of clinics, but I don't have to know how to read an administrative warrant versus a judicial warrant anymore.
Yeah. Yeah. Gosh. I I look at that, Lord, first off, if I haven't said it, thank you for what you're doing. It is you're literally changing lives, and there's a story that I heard not too long ago, from, I think it was Brene Brown, was talking about her experience going into a cancer hospital, and she sees this lady pushing a cart full of little snacks and whatnot, and she says to the lady as they're riding the elevator, "So what do you do at the hospital?" And she says, "I cure cancer." And she goes, "Really? Are you a doctor?" She said, "No, the doctors need food so they can perform well.
That's right.
So I help cure cancer." And it was a mentality, not of just that individual, but literally every individual that she went around to the hospital speaking to on staff, they were all together realizing that I'm a part of helping cure kids' cancer. And so when I think about what you're doing, don't diminish it like, oh, but you're literally helping to change and save lives because of the devotion to what you're doing. I will ask you one thing, because when I think about the current crisis and what we dealt with in 2020 as well, when I was working with the unhoused population for several years in Louisville, Kentucky, in 2004 or five, I can't remember the year, we got hit with Hurricane Katrina, and everyone who was alive during that time realizes how big a deal that was, how much devastation occurred, because it wasn't just in Louisiana. It would, it went from Texas to Arkansas, like it hit that whole region. And Louisville, Kentucky was picked as a city that was going to receive 15,000 people who were displaced. And these weren't just, the unhoused population, or, some of the clients that I worked with were, they earned like $300,000 a year in 2004. You know what I mean?
Yeah, but if they lost their home, they lost their home.
They lost their IDs, they lost all their
Yeah.
cash, that like they had trouble proving who they were. But I guess the long and short story of it was, I was working shoulder to shoulder with a very dedicated group of people
Hmm.
who were helping people, get reestablished, find homes, find jobs, get, just start over, get the mental health care that they needed, what have you. But I'd say after about that third month of, dealing with that massive influx, the system was still holding, but the people were tired.
Yeah.
They were exhausted, and I was one of them. And I'm curious, I know what I did personally to maintain my personal mental health and well-being. What are some things that you are doing to maintain your mental health and keep your well-being during this time? And what are some things maybe that you might recommend to others in healthcare who are just going through it right now?
Yeah. Well, a very little thing that I just did last week is that I learned when I take a vacation, my family was traveling, I literally have to turn off my work email to my phone because it's muscle memory. I will grab the phone and I will start looking at that email whenever I have a little bit of downtime, and making that very tiny digital disconnect so that I couldn't quickly look at my email is a real game changer in terms of resetting your brain. So that's a little teeny tiny tip that makes a big difference to me personally. But on a bigger scale, it's about building my squad, building my people who are also going through it, who I can talk to, whether it's my colleagues in my own organization or leaders in other organizations that are also doing great work, but facing a lot of the same difficult times, difficult challenges. I need to have those three or four people who I can text about whatever the weird thing is going on that day and say, have you ever been through this? Have you done this before? Oh my God, I just need to complain for 1 minute. I just need to blow up some steam and let you know that this is going on. And for you to tell me, oh my God, that really sucks. I've been there too. So I think those are really the biggest pieces for me. And then on a daily basis, I have to move my body. I don't know why I live in Chicago. It's really cold here, like half the year. And I love Chicago, but ooh, in the winter months, sometimes I question that because I want to be outside. Last week I was on vacation in the mountains and I just wanted to be out in the sunshine hiking every single day,
Yeah.
because moving my body in the sunshine has a tremendous impact on my mood, especially when I've been living through Chicago winter.
Yeah. Yeah. With very little sunlight at all. Gosh, I remember my few times there in the winter, and I thought it was bad in Indianapolis, but holy cow,
No, it's
Chicago's a
nothing.
whole different
Yeah.
beast.
Yeah.
Oh goodness. Well, I think of a few things in terms of self-care and looking after yourself as one aspect of this, on more of a micro level. If we kind of zoom out on a macro level and look at healthcare through the lens of empathy in general, in your opinion, what are we getting wrong? What could we do that would make things a little more community centered? And if we want to just throw the cherry on top of that, what would a more empathetic system look like?
Gosh, almost anything else. You know what?
say more, Laura.
You know what is amazing to me is that the concept of health insurance, private health insurance in the United States, grew out of mutual aid. This is
Mhm.
wild. This history is wild to me because it came from the concept of Black communities and immigrant communities who didn't have access to the same money and the same resources as some of the more privileged neighbors, built up reserves to help each other when they needed something. And that's how health insurance started. That's how people started building up health insurance. So when someone got cancer, the community came together to pay for their treatment. And then it became a for profit business. And we have not only for profit health insurance companies, we have for profit hospitals in a lot of cases. And watch The Pit. Like everybody needs to watch The Pit because that show is real. It is a masterclass in the pitfalls of our healthcare system.
Yeah.
The way it needs to be is that the way these clinics do it, we need the community to tell our healthcare providers what they need. And then we need those providers not to have to have a 15-minute appointment where they rush in and they ask you three questions and they rush out again because they need to bill for their next patient. In those free and charitable clinics, our providers are spending 30, 45 minutes with each patient. So
Yeah.
they really understand not just what their symptoms are, but they understand, oh, wait a minute, you're taking your medication with grapefruit juice at breakfast? That could cause an interaction. Oh, wait, you are eating at this time because you work the night shift and that's throwing your blood sugar out of whack. When our providers have the time to really get to know the patients, to really hear their circumstances, they can provide so much better medical care. They can get better health outcomes. It can be health care, not sick care. In this country, we have this system of sick care that people go to the doctor when something is wrong. What we need to do is take care of people's health first so they don't end up getting sick and going to the doctor in the first place. Almost all of the leading causes of death in this country are preventable or treatable. It's
Mhm.
chronic diseases and it's cancer that, had we caught them and treated them sooner, should not have resulted in death.
Yeah. Yeah. And there's so many of them that are born out of stress,
Yeah.
that is just chronic in our country, and it's
Lack of
sad how
access to
many.
healthy food. Yeah. Like,
Yeah, yeah. I mean, basic things.
yeah.
There's so many things in this country that were built out of necessity and out of care and out of community that kind of, I mean, for lack of a better word, became cannibalized just to the nature of how we do things. But
I just,
there's hope, because even with all the craziness that is going on, you've got your clinics.
mhm.
You have educators who want to spend extra time with the kids. There are, you know, communities that will not let a family go under, in terms of the farm. They roll up their sleeves for each other and take care of each other. And I mean, that's in every community that I've visited. So the hope is there. It's just looking at some of these systemic issues that continue to create unnatural roadblocks
Yeah.
for the things that people need.
When I think about, I was just thinking about a story when you were saying that 3 years ago, when mostly the state of Texas, but Florida a little bit too, they were busing individuals from the border up to
Yeah.
blue cities, um,
Yeah.
and people who were seeking asylum. And a lot of those people, when they got to Chicago, Chicago received over 50,000 people between May and September of that year, um,
With no plan.
with
With
no
no plan.
plan,
Just
no
dropped them on.
plan in
Yeah.
a city, in a major city that has about 5,000 shelter beds in their homelessness um, operation. So there was no plan whatsoever, and people were sleeping on the floors of police stations because there is a little loophole in the law that police stations can be used as warming stations in the city of Chicago. And so every single precinct in the city of Chicago at some point had people sleeping in it, entire families sleeping on the floor for weeks and months at a time. And my clinic went out. I led this effort where we went out to the police stations a couple times a week. And this clinic was not a mobile clinic. Lots of the clinics in the association are mobile clinics, but this clinic was not a mobile clinic. This was a clinic with volunteers that took a couple folding tables and a rolling suitcase full of medical supplies and went out and set up on a sidewalk outside of the police precinct and saw patients for medical appointments all day long, a couple times a week. And there were lots of health conditions that needed treatment. There were lots of people who needed follow-up appointments, who needed medications, needed things like that. But there were a lot more people. Every single person there just needed someone to talk to, because in many cases, before they got to the US border, they'd been walking for months through the Darien Gap. They'd experienced a significant amount of trauma from a very difficult journey, often from violence that they experienced along the way. And they were traumatized. And one of our nurse practitioners said to me, she spent 90 minutes with one of those women one day. And she was like, she just wanted to talk. She just needed to tell somebody her story. That's the way healthcare should be. Not on the sidewalk, ideally, in a comfortable medical facility. But if the person's health depends on them just being able to tell their story, that's what we should be providing.
Yeah. Yeah. I think of so many things that we see for our people who are in need of health care. I mean, in general, not emergent, just the little things that could help prevent, these healthcare emergencies, and the system just isn't set up for it. I mean, you'll get the notes that say, "Hey, you should go get, checked every once in a while. You should do this. You should do that." But we don't systemically make those things available for people, and it creates the issues that we're seeing now. And you talked about the pit. My wife and I sit back and we just, our jaws drop, on a regular basis, just kind of like looking at the different scenarios and how real. We both worked in social work and case management, and we've seen it, and we're just
Yeah.
like, wow, they're really going there. They're really going
Yeah.
there. Well, in fact, one of our guests last season, Annie Toe, played a paramedic on the pit. She had speaking lines the last episode, so we were super excited for her. But the drama that plays out on TV is unfortunately more reality than not that you see from that show. For those who are not medically inclined, those who have no training, no ability to join your group with marketing and communications or whatever the skill might be, but they do want to make a difference. The listeners who want to know what are practical ways that me as an individual or as a leader of an organization, how can we support community-based healthcare efforts?
Find a clinic in your area. If you don't know what it is, There is a national association, just like we're the Illinois Association. So my website is illinoisfreeclinics.org. And we have a directory of all of the clinics that we know of in Illinois, and we're adding to it every single week. There's also a National Association of Free and Charitable Clinics. Find those clinics and make a contribution. I'm not medically inclined either. I have a degree in theater and a minor in French. But theater majors can do anything. So that's my refrain. That's what I tell everyone. But these clinics need support, and they are for the most part, not funded by government grants. A lot of people think, oh, this is a government run agency. Absolutely not. Free and charitable clinics are privately funded. That means people like you, that means foundations, that means corporations. We rely on donations to make it possible for all of this free healthcare that we're providing. So that is my best advice. And if you have any interest in volunteering, please volunteer. And if you're not a medical provider, but you speak another language, there's tons of need for volunteer interpreters. Volunteer interpreters are the lifeblood of free and charitable clinics too, because so often we have a provider who wants to be able to communicate with the patient and they are not able to because they don't speak their language. So that's another way to get involved.
Yeah. I'll say this for Laura in Illinois or anywhere else where you're looking into clinics in the area to support. There are two things. Number one, financially, they don't necessarily need $1 million donation from individuals. The impact of a group of people giving $5 a month really changes things. It allows them to kind of set their budget for the year, knowing that this monthly amount is coming in from the group. So, predictability in a time of not a whole lot of predictability is incredibly important. So that's number one. Number two, do not underestimate the impact of your hour per month if that's all you got.
Yep.
To go, as I was saying in one conversation last season, they don't necessarily need you to come out for hours and hours and hours and just become this beast that knows everything about the clinic. No, maybe sometimes it's just pouring coffee for people.
Yep.
Maybe it's stacking materials in the closet for crew and others who can't get to it. Just being available and saying, how can I help?
Yes.
It creates an opportunity for people who need a break to take a break and catch a breather for themselves. So, Laura, is there anything else that you would like for people to know other than donating and getting involved? Is there anything else that we should make sure that people are aware of today?
Just ask the community what they want and what they need. That is the best advice that I can give. And that's why every clinic in my network is so unique, because I'm not an expert. I can't come in on high and tell somebody, this is what you need. You need a dentist here and you need this. No, the community will tell you what their needs are. Just ask them. They're the experts.
Awesome. Well, thank you so much for joining us, Laura. It's always great catching up with you. We'll have to get you out here to Charlotte sometime.
I'd love to. I hear it's warmer there.
Yes, absolutely. The Unbroken Place podcast is presented by Eddy Paul Thomas, LLC, and sponsored by Elevate One Consulting and OK on Second Thought Coaching. The show is produced by Say Something Studios. Learn more about our sponsors and producer in the show notes. The show's music is performed by Kesta. Thank you for being a part of the Unbroken Place podcast community. Look for an ongoing conversation on TikTok, LinkedIn, Instagram, and Facebook. And make sure to sign up for our newsletter called Things I'm Rethinking at eddypaulthomas.com. Until next time, one love.